of night, it brings refuge, and we ran and hide by light of the moon.
Hey there, welcome back to my channel. This is Jill, aka Sochella for those of you that are new. This is yet again another installment of my self-entitled series called Illustration. In this video, I'll be interviewing 3 healthcare workers from the Indiana and Illinois region, and we'll be debunking some myths, discussing recent healthcare advancements, as well as discussing the impacts that Corona has had on Black and Latinx communities. If that sounds of interest to you, then please stay tuned for the interview.
So I guess we could start out with doing introductions. So just like, who are you, and then like what your roles are.
My name is Joel. I'm a registered nurse. I work on the west side of Chicago in one of the safety net hospitals. I've been an RN for about over 6 years, but working at this place for 6 years. And first time working in a pandemic, so go figure.
So my name is Bea or Bella. I go by whatever you want to call me. I am currently in Goshen, Indiana, which is a small town close to South Bend. Maybe more people are familiar with South Bend because of Mayor Pete, who ran for president, and Notre Dame. So I work at a nonprofit clinic called the Center for Healing and Hope, and the majority of our patients that we serve, like 99% of them, are people who don't have insurance, and the majority of those people that we serve are people who are undocumented. So it's also a charitable clinic here in Goshen, and my role is the patient care administrator. So we're actually really small staffed at the clinic, which has been really interesting, especially in the middle of this pandemic. I think that the size being so small, it's more manageable to change the roles and stuff of what needs to happen during this pandemic. So that's kind of, yeah, that's where I'm coming from.
I'm Tashina. I've been a CNA for maybe since 2016. Like Joe said, this is my first time working in the pandemic, so I have a lot of inquiries about like how things are being ran. I've been at where I currently am. I've been here since March 9th, so basically like right before, it was ruled a pandemic before it started. And I mean, it's getting better. I'm just tired of getting headaches from wearing a mask all day. That's pretty much it.
I second that.
Going into like talking about the pandemic specifically, like what do you guys feel have been some of like the positives, and then also like the main setbacks for you all as healthcare workers during this time?
I would say for me, it seems like everything that we've been arguing and fighting about as far as like us being important workers and how we should get paid, how we should get staffed, how we should, prepare way ahead of time for situations like this so we can avoid, outbreak. We can avoid, we can make better infection control, and also we can avoid a lot of deaths if we have more awareness of the importance of the things that you sometimes don't think about until it happens. So that's been my biggest issue, and I feel like it's more awareness of worldly conditions and like poverty conditions and poor people's conditions and workers' conditions. It all has like really came to light because everyone has been affected. That's why everybody is aware about the issues that have been in our healthcare system this entire time.
Mm-hmm. No, I hear you. I definitely dive into like more conversations around just kind of like our frustrations on like in a political sense, because I know all of you guys are to some extent involved in activism on your own time, and then also even within working within unions and stuff like that. But I know that Joel had some friends who had some questions, so I figured we might do like a speed round of like just questions or like busting myths that people have, I guess. So I guess the first question would be, how do people get tested even if they don't have symptoms? And then also like, what are like some main symptoms to be concerned about?
The testing kind of varies depending where you're at. I mean, like, if you're talking about being out in Goshen versus being in Chicago, even different parts of Chicago. I know the place where I work now just finally got a machine where they can do rapid testing. So they can do some like 400 a day, which is like a huge leap from what they were able to do. And because I would say they're at least testing 100 people a day, which is a really high number. But short of going to the emergency room, because a lot of people are trying to avoid that because they're just scared to go into that situation. I know on the west side, I know also that Lawndale Christian Health Center, which is a big network, does a lot of charity care. They're now doing 400 a day. So I think if you're concerned about it, I know Rush does drive-in, but I don't have to be network. I know they kind of cater to a higher echelon of insured patients. I did actually post something. I'll have to go refresh back on it as to where you can get tested in the city. It's from a couple weeks ago, so it's probably updated from there. But yeah, I think those are the main places right now that I direct people to in my area.
The question of testing has been really interesting for us. And again, because we're a nonprofit small clinic, we're able to manage things more closely. So at our clinic, we actually started preparing even before the government started preparing. So we were in contact with the health department of the county. We were in contact with the different hospital chains in the area. And every day things change. So testing requirements change. At first, it was really, really rigorous because a number of testing was just not available to people. And so they were only testing people with severe symptoms. And then they got a hold of more tests, so they were able to expand to healthcare workers. And now they're getting more tests to keep expanding. However, the biggest situation we're seeing at our clinic is that all of the testing centers in the area require a doctor's order from your family physician. And for a lot of people, especially uninsured and undocumented people don't have healthcare providers. People don't have the luxury of having a family doctor they can call up and get these orders. So one of the new programs we started at our clinic is a COVID line for people who think they have COVID symptoms or who need to go back to work but can't go back to work because they need like a release, but they can't get it from a doctor. They can call our line and they can get a consult with one of our providers. And then we can send them in with an order to go get tested. And we're actually, because we're a nonprofit, we have access to different organizations like Direct Relief, AmeriCares, and we are trying to secure point of care testing, rapid testing, like Joe mentioned, to be able to have those in our clinic. And we're actually getting everything ready right now to get the volunteers in place to be able to test the uninsured community. Because for the same reason as Joel said, a lot of these patients, especially undocumented people, are afraid to go to hospitals or are afraid to go to urgent care centers to get tested for many reasons.
Well, I don't have much from my perspective. I just know they've implemented the rapid testing at our job. I've heard that it was a testing center at Roseland Community Hospital, and I also overheard that they had opened a new testing center in Markham. It's at one of the old admissions places. I don't know the direct addresses, but I've heard a lot of people Roseland has been up for maybe like a couple weeks.
You had mentioned about the symptoms that people experience.
Yeah, so I know there's been like a lot of, conversations around like different symptoms coming up. I know recently there was someone else talking about how like the lack of taste or something like that is a new symptom that's coming up. So I just wanted to know, like, based on like you guys caring for COVID patients, like what have been new things that have been coming up or the most consistent symptoms at least.
Just from my experience, and like I said, I've been on a COVID floor dealing for patients directly 3 times now, 3 shifts. I think I've caught them more on the tail end, so their symptoms are less severe. I think definitely a very acute shortness of breath, a productive cough. I think that's more of the late stages, and then what people really show is just a lot of fluid collection in their lungs with chest X-rays and CT scans. That's more along, like more specialized diagnostics. But yeah, I think main thing, just scratchy breath, uh, productive cough, shortness of breath. I think those are the main things. But those things, it's interesting because those things can present in lots of different respiratory infections, and that's where a lot of frustrations come in, is because it could be something else, but people start experiencing something, and like maybe anxiety and stuff kind of drives it, kicks it into overdrive, and they don't know, and then for a long time up to this point, it's been very hard to get tested. So there's just been a lot of uncertainty if you're walking around with it, but you can't get tested because you're not prioritized up to somewhat recently.
So one of the things too that we've been looking in regards to testing is, I think it's 4 of 10 or 3 of 10 of the tests that they've been running, like PCR testing, are false negatives. So people could still have had COVID, but those tests aren't going to detect it. So I think the newer tests that are coming out, like some of these some of these new point of care testing, are antibody tests, so that we can detect whether your body had developed antibodies to fight COVID, and that'll show us whether you already had a COVID infection. However, I think the biggest issue right now is that a lot of these are being manufactured really fast, and they're not getting like the CLIA waiver or the FDA approval to be able to do those here. So like we've been hearing a lot of other countries getting access to these tests, and those tests are some of the ones that are coming here. They just haven't been approved by the US to be able to implement these.
Gotcha. And would you all say that once people have like gotten COVID, that they have like impacts that surpass that time frame, even if like they've recovered from it?
Yeah, I mean, I think like people will get admitted to the hospital, and I've discharged people that actually are still like COVID positive, but their symptoms are managed. But like you talk about like the repercussions. A lot of people, they can't really self isolate. If you're talking about people that share living quarters with a group of other people, and not everyone has like the capacity just to isolate themselves for 2 weeks. I mean, people are kind of lots of times cramped in, or at least sharing a floor, sharing an apartment with somebody else. So I think even with the repercussions for yourself might be gone. Like if you go back to a living situation and you have, it's just hard to maintain that isolation. I mean, you tell people wash their hands and wear masks and stay, separated from your family members. But it's, the place it's small, and there's still a very big risk of this stuff continuing to spread after one person's symptoms have more or less been taken care of. They still could be contagious, even though their viral load is probably less and their body's making antibodies. There's still potential they can, sneeze into their shirt or cough on their hand and they spread it, and then another family member or roommate has it now.
So I think another thing too to keep in mind, so I actually, I studied microbiology and virology as an undergrad. So it's kind of nice to be able to have this knowledge and be in healthcare, to have the knowledge of viruses and infections. But one of the other things to keep in mind is this virus is so new. So the coronavirus, as many of us already know, is a family of viruses, and COVID-19 is specific to this pandemic now. But there's still a lot of really new information that we are up to date on. So we think, or a lot of people think, that after 14 days of not having a fever or not having symptoms, that people are no longer contagious. However, there's still areas in China that they're finding, or I think South Korea was the most recent one too, they're finding waves of reinfection, which is something that isn't very common with viral infections. Well, I guess it depends on which virus family, but so there's a lot of uncertainty, and I think that it's really important for providers and healthcare workers to keep up to date with all of this information. And it's really hard to do when there's so much myths and so much misinformation in social media that gets circulated. Like I hear my mom and my aunts talk about stuff they see on WhatsApp, and I'm just like, No, that is not right. So I think it's scary because everybody's scared and nobody knows what to believe. And this is also so new, and there's new information coming up every day.
My mom kind of is similar. She'll like see like a random article or like a video on Facebook, and she'll like send it to me and be like, "Be careful! They're putting it into our groceries. Don't go outside." But yeah, so like, how do you guys feel about just like the impact that it's had on society, and then also like just like the government response to it as well?
Yeah, that's all of what everyone's have been talking about since it surfaced. Like since everybody became aware of it, that's every topic of every conversation really. And I believe it because a lot of people, like you said, a lot of people are scared, and a lot of people found out how serious it was. To me, in my opinion, a little bit too late. Because it's just like when it first came about, everybody was still going about their normal lives, and now they're like, "Oh shit, this is real. This is like you can literally drop. Some people drop dead, some people recover, and some people have any symptoms. It all depends on. For me, it seems like it doesn't. It's person to person. It's very individualized, and I think that's a real scary part about it. Especially for us in the healthcare field, because we have to expose ourselves, but we try to protect ourselves at the same time.
Don't you feel like the reasoning why people weren't taking it as serious is partially to do with like people like Trump saying that, oh, we've got it under control, like it's not going to be as hard as the other countries, like we're fine, there's like 5 cases in the country.
Yeah, I think all the misinformation that happened at the beginning is the reason why a lot of people didn't take it serious. That person, oh my God, Trump, he doesn't help any situation. He really does not, because he just such like, I don't even have the words to describe him. But his attitude towards everything doesn't make anything better. And it's just like the way he's leading, it's basically having everybody fend for themselves and their family, or their own state that they govern, all that. And I feel like at the beginning we were looking towards leadership to help us navigate the situation, but now since it has affected everyone, and I think that's why we're just trying to figure everything out together, and that's what I really appreciate about it. But it has definitely hit home. Like I'm staying with my sister now because my brother, him and his family, they came positive with the virus. Don't know how they got it, and he has to isolate himself from his baby is younger than mine. His baby is a week younger than mine, so his baby is maybe like about to be 5 months positive for COVID. Wife positive for COVID. Her mother positive with COVID. My brother positive with COVID, and it's just like the worrisome part is we don't know like the long-term effect of this virus. That's the scariest part for me as well. It's bringing it home to my daughters, who if my youngest, how hard it's going to be on her having a new virus, anything. My 4-year-old, she has bronchitis, having bronchial inflammation on top of having a respiratory infection. Like it's no good. So it's worrisome, which we're all trying to get through it, and we're trying to figure out the best way to get through it, pretty much.
About it. I mean, yeah, like you bring up a good point that like people with already pre-existing cases are even more susceptible to having longer term effects by it. It's also just kind of like the impact that it's had on like communities of color as well. So it's like, I mean, like Black and Latinx communities are not necessarily as like socially mobile to be able to just like, oh, I'm just gonna social distance from my whole family and like everything's gonna be good. So yeah, I guess I wanted to hear like Bella's experience as well about like just how you feel like it's affected like the Latinx community, especially like undocumented individuals.
So I think I'm totally on board with what she was saying too. And for me, I'm a virus nerd, and they always will hold a special place in my heart. And from the beginning, when we first heard about this coming from Wuhan, I suspected that if it ever came here, what was going to kill us was not the virus, but the government and the lack of structure and the lack of support for marginalized communities in this country.
Thank you so much for watching. If you enjoyed the discussion, go ahead and give this a thumbs up and let me know your thoughts down below in the comment section. In the second part of this interview, we'll actually be diving deeper into our opinions on the government's response, as well as our thoughts and advice on workers' response as well. So be sure to go ahead and subscribe and click the notification bell so you don't miss out on the next upload. And I will see you guys in the next video.
How low, wherever you say I will go.